the danger of these drugs is we can look at large studies. For example, there's one out of Pennsylvania. I believe there's another similar study with similar outcomes in England looking at sleeping medications in a large patient population. And there was a significantly increased mortality in 5 years from taking as little as, I believe, something like 11 doses of sleeping medication in an entire calendar year.
Wow.
If we look at antipsychotics, okay, which are some of the most prescribed drugs, things like Seroquel, Zyprexa, Risperdal, there was a study looking at all the Medicaid recipients taking these drugs who were teenagers. I believe it was in the state of Tennessee, and it was a pretty large number of kids, and a substantial number of them had sudden death from these drugs. And I've seen at least one case like that from my own experience of sudden death from an antipsychotic. And then we have antidepressants, and we can also look at several studies. There's a large Canadian study which shows from people just taking SSRIs that they have increased mortality of all cause in 5 years, and they had increased incidence of strokes, and that's one of the mechanisms for the increased mortality. So just taking these drugs has serious health consequences. It's difficult to get off these drugs, and there's really no proof of any substantial benefit.